Hello and welcome back to the channel. So in this lecture we are going to discuss what are the different types of twin pregnancies, what are the possible complications both for the mother and the baby, and how it is managed differently from a singleton pregnancy, and some discussion about and details about the possible complications. I'm Dr. Asmath, and this lecture is intended for undergraduate medical students. So, before we start the actual topic, just a reminder that in obstetrics we have different subspecialties, and one of them is fetal medicine. So, fetal medicine, yes, the doctors are actually obstetricians, but they deal with complications with the babies like congenital anomalies or complicated multifetal pregnancies or severe IUGR. Okay, so that's just one branch of obstetrics. So the learning objectives is to know what are the different types of twins, the possible complications associated with different types of twins, how are they antenatally managed, and anticipate complications. Okay, so what causes twin pregnancy? Actually, all over the world, the incidence of twins it's increasing, and it's one of the reasons is secondary to assisted reproductive technology, which is like IVF or ICSI, right? So it's considered a side effect if because of IVF or ICSI there is multiple pregnancy, twins, triplets, and so on. It's considered actually a side effect. Okay, so even ovulation induction, so it's considered a side effect. And why more women are resorting to having assisted reproductive technology? It's because usually because of lifestyle changes or careers, right? So some women they prefer to have establish their careers first, and as a result, they may start their families at a relatively more advanced maternal age. And of course, genetics also play a role. So it's the highest incidences in Nigeria. In fact, there are few towns, or you can say villages in Nigeria, where it is celebrated as an annual day. So World Twins Festival. If you just Google search, you will come across such videos. Now, how is multiple pregnancy classified? Right? It can be classified depending on the number of fetuses. For example, if there are twins, if there are two babies, it's twins, triplets, three, quadruplets, four, and so on. Then it may depend on the zygosity, right? So what do we mean by zygosity? It means what was the actual number of fertilized eggs, right? So if the twins arise from one zygote, which later split into two, that would be called a monozygotic, which happens less frequently. It's only 30%. But if there were to begin with, if there were two zygotes, that's called dizygotic twins. Another common name is fraternal twins, which is 70% of all twins. Okay, so clinically we do not know whether a twin pregnancy it arose from a single zygote or a dizygotic, like whether they are dizygotic. We will discuss about this thing later on. Okay. So, and then chorionicity. Chorionicity is actually the number of placenta. Okay. So, how many placenta are there? Is it that both twins are dependent on one placenta, or do they have their separate placentas? Okay. So, then we say the terms which are used are monochorionic if it's one placenta, or dichorionic if it is two. And then amnionicity, because amniotic sacs, right? The gestational sac, the amniotic sac. Okay. So how many number of amniotic cavities are there? So it will be called monoamniotic or diamniotic. So dizygotic twins, right? Dizygotic, as I said, that they actually come from two different zygotes. So, in simple terms, you can say they are two siblings which by chance are present at the same spot at the same time, right? Usually, siblings come one after another, right? So, usually, siblings, if they been singleton pregnancies, they do not occupy uterus at the same time. But in zygotic twins, yes, they are siblings and they are present in the same place at the same time. Okay, but they originally started from different zygotes. Okay, so that means, like in different siblings, they can be same sex or they can be different genders. Okay, so it can be one girl or and one boy, or it can be both girls and both boys, right? So it's like having other siblings. And usually, like we see that sometimes it runs in families, right? Like, for example, in Nigerian families, a lot of them. So these dizygotic twins, they are more likely to they run in families. Okay. Dizygotic twins are always dichorionic. So please remember that if the origin to begin with, if their origin was different zygotes, then they will always have their own separate placenta. Okay. So they will always be dichorionic. Dizygotic twins are always diamniotic, which means if they had separate zygotes, they will have their own separate cavities, their own separate, you can say, rooms. Okay. And dizygotic twins can be same sex or different sex, as I said. Okay. Now, monozygotic, right? So, monozygotic is the origin of these twins. It started from one zygote. Okay. So, because genetically they came from one zygote, so they will always be same sex. So, the gender will be same. It will either be two girls or two boys. Okay. It can't be one girl and one boy if they are monozygotic. Okay. So, but what happens? They can have one placenta or they can have their own placentas. Okay. And they may be in one amniotic sac or they can have their own separate rooms or own separate amniotic sacs. Now, what determines whether they will have one placenta or two placenta, or will they have their own separate these amniotic sac, or they will be sharing same sac? So, what determines? So, how it is determined is at the time of splitting of this zygote, when the zygote was split, divided, at what stage did this happen? Like after how many days of fertilization? Okay. So if, for example, if the splitting of zygote happens soon after fertilization, okay, within the first 4 days, right? Less than 4 days, then what will happen? So, because the split happened very early on, so they are relatively safe. They have their own placenta and they have their own gestational sacs, their amniotic sacs. So, it is called dichorionic diamniotic if the split happens early on. If this cleavage or split happens slightly later, between 4 to 8 weeks, by that stage blastocyst has formed. Earlier on, it was called morula. So if it splits at the morula stage between 4 to 8 days, what happens? They still have different amniotic sacs, but the placenta will be, there will be one placenta. Okay, so they are their both umbilical cords will be different. They have their own umbilical cords, but these umbilical cords, they are connected to one placenta, right? So that means they have less food stock, right? Because they are sharing the same food reservoir. Then, if this cleavage happens later in the second week, right, between 8 to 13 weeks, right, then what will happen? So, yes, they will have one placenta like these, but they will also share one amniotic cavity. So these twins at this stage of cleavage, they will be monochorionic and monoamniotic. Okay. And say, for example, even if this cleavage or division of the zygote happens much later, right? Right? In the third week, actually, after day 14, then what will happen? Yes, they will have a same placenta, they will be in the same amniotic sac, and they will be conjoined twins, right? They will be joined at some point in their bodies. It can be head, it can be chest, it can be legs, like at some point, we don't know, but they will be conjoined because the cleavage happened much later. So in general, the earlier the cleavage happens, the better it is for them, even if it's a monozygotic twin. The late it happens, the more serious it is. And the best, so the least risky type of monozygotic twins is when they have separate placenta and they are in separate cavities. Okay, but if they share one placenta, that can give rise to different kind of complications, which we will discuss in coming slides. Okay, so this is just a repetition. Yes, initially to begin with, there was one zygote which later split. Okay, so monozygotic twins, they are identical because their genetic origin was same. They will be same sex, single ovum fertilized by sperm, and later there is division of zygote. Now it depends at what stage they split. So they can be dichorionic diamniotic, monochorionic diamniotic, or monochorionic monoamniotic, and the highest risk is for monochorionic monoamniotic. Okay, so these are all the types of monozygotic twins. Okay, dizygotic, they are, so dizygotic are different, right, which we discussed already. So dizygotic compared to monozygotic twins, dizygotic twins are less risky. Okay, they have less risk. Now rest I will discuss in the